Now, when we were studying about osteoarthritis and rheumatoid arthritis, we came across some terminologies. That's basically some crystals that get deposited in joints. They could be deposited elsewhere too, but our most important focus was the deposition in joint. So when they are deposited in joint, they get to form a lot of inflammations and all of that. So those two crystals were what? The monosodium urate crystals and also the calcium pyrophosphate crystals. Now quickly get to look at them, we'll define them and also talk about what they are. So you can see that on imaging, this is what monosodium urate and usually causes gout. While the calcium pyrophosphate dihydrate deposition disease is caused by what? The calcium pyrophosphate crystals. Okay, then it also causes, well, it's the same thing as pseudogout. Do you understand? This one causes the real gout, this one causes the pseudogout. So looking at the monosodium urate crystals in the first discussion, we said that what it usually causes gout. I didn't bring the pictures of, well, this is pseudogout, alright, and gout is like the real one. So it's formed due to what? Hyperuricemia. So if uric acid levels in the body are too high, so the shape is usually what? You can see it like a needle, like you pour plenty needles on the floor. Okay, so it's birefringence under polarized light. It's a strong negative birefringence, so appears yellow when aligned parallel to the axis of the compensator, blue when perpendicular. So typical location is usually in the synovial fluid of joints, especially the big toe. Okay, so clinical features is there's a lot of sudden severe pain and the joint is red, is swollen. Do you understand that kind of thing? Okay, it reduces the range of motion and the rest of it. You're not able to use that joint like you used to use before. Then next we have the calcium pyrophosphate dihydrate. Look at this. You see that for the calcium pyrophosphate dihydrate, it's looking more like, rhomboid shape. It's not pins and needles. Okay, so for this one, you see that it's associated with pseudogout, which is sometimes called what? The calcium pyrophosphate deposition disease. Okay, so origin is a deposition of calcium pyrophosphate in cartilage and synovial fluid. See the rhomboid shapes that we're talking about. This is like a high, microscopy. So crystal shape is rhomboid shape. Birefringence under polarized light. It has a weak positive birefringence. Appears blue when aligned parallel and yellow when perpendicular. So it's typically deposited in the knees, in the wrist, and other large joints. It causes acute joint inflammation similar to gout, but often in older adults. Can also cause chronic arthritis. Okay, so that's what we have for these two crystals and their differences.